October is Domestic Violence Awareness Month, and on this Mindful Monday, we're discussing a sobering statistic from a new report. 85 people died in Wisconsin at the hands of domestic violence in 2023. Joining us now is Stephanie Young from Gunderson Health System to discuss the risks of homicide in abusive relationships. Thank you for being here to
Thank you for having me.
talk about such an important subject. So, what does the report tell us about the risk of homicide in, domestic violence relationships?
This report tells us that the risk is incredibly high, especially here in Wisconsin. Unfortunately, 1 in 6 domestic violence homicides in the United States happens here in Wisconsin.
Wow.
So it is a hometown problem for sure. This report's also really important because it helps us remember the names of the victims. Oftentimes we focus a lot on the perpetrators of the crimes, especially when they go through the criminal legal system, and we really want to remember the people who are really impacted by this. It also tells us that while primarily women are the victims and men are the perpetrators of the crime, there are also other people who are victims of the crimes. Children are unfortunately victims in these homicides, and we also see that domestic violence happens in all kinds of relationships, in LGBTQ relationships. The report tells us that people of color are disproportionately impacted by this, and also law enforcement. One of the most dangerous calls law enforcement can respond to is a domestic violence call.
Wow, okay.
So what are the key factors to elevate domestic violence?
I think often we focus a lot on what the individual did or what the individual victim should have done. That can be a lot of our focus, but domestic violence is a really complex issue that really requires societal solutions. So just to name a couple, because we can't be here that long, would be, a lack of affordable housing, which is an issue here in La Crosse and across the country. But when people don't have safe places to go to, that can really negatively impact somebody leaving a dangerous situation. And also just a lack of gun control. What we find is that in this report it shows that the involvement of guns just really increases the lethality, and that so many more people were killed because of access to guns.
Okay. And any, specific warning signs that a relationship might be heading toward that homicidal risk?
I think what we see is usually an escalation over time. So starting maybe with the verbal abuse and that power and control really increasing over time, and then the physical abuse, and then that physical abuse increasing. We also might find that even if that relationship hasn't gone on for a long period of time, there's usually a history of escalation of abuse in the perpetrator's past relationships. So just it's an escalation overall over time.
And if we do suspect, someone we know, or maybe it's happening in our own relationship, what can we do?
I think what's really important is just connecting people to resources. So one of the most dangerous times for somebody who, or one of their greatest risks of homicide is when they leave the domestic violence relationship. And so the solution is not just for that person to leave and get themselves away from the abuser. That's an incredibly dangerous time. So we want them to have access to resources, access to options, and for that planning to occur over time to make it as safe as possible for them to leave that situation.
Okay, and Gunderson has a hotline, domestic violence and sexual assault program, and a hotline. What can you tell us about that?
Sure. So we are a public health program based in Gunderson, and because of that, we're able to meet people earlier in their experience with abuse, which is really important, and we really connect people with those resources. We help them with safety planning, helping them set up options for future housing, things like that, laying in the things that they're going to need to hopefully leave that relationship safely, and that requires support over time. And our services are completely free.
Okay, great. And we had a phone number up for there. Is there a website people can go if they're interested in learning more about that?
Just GundersonHealth.org, and then searching domestic abuse. But there's a lot of national resources as well. And like you said, we have a 24-hour hotline.
Okay, great. Well, thank you so much for being here to discuss such an important topic.
Thank you.
Stay with us. We're back right after this.